Thank you very much, Dr. Wells, and more importantly, I thank you for attending today and for people for tuning in to learn as much as they can about what's going on with the particular pandemic. As we're all aware, the testing capabilities for the COVID-19 illness in the United States were both delayed and limited. That created a lot of anxiety for people who were concerned about their own status, are they infected or not, and it also hampers the public health capabilities and our response. It's hard to craft an effective plan when we don't know really who has the infection and who doesn't. By creating our own test and using an accessible collection point, we can alleviate some of the burden on our public health partners, and we can also ease the concern of our patients by getting them the diagnosis in hours, not days. Beginning on Tuesday, we will direct patients who received physician care and have symptoms of COVID-19 illness to a specimen collection site at our building located on the South Side, 2000 Mary Street. This collection site is not open to the general public. Let me restate that. It is not open to the general public. Patients must have a physician referral. They must be approved by a UPMC infection prevention expert and must have an appointment to have their specimen collected. These specimens will be tested either by the UPMC labs or public health authorities. Let me reiterate that collection is by appointment only and only for patients with an approved referral from their physician. We are not able to test anyone who wants a test today. It has to be through this mechanism. If you show up without an appointment to our Southside location, we won't be able to obtain your sample. And you may actually hinder the ability for people who want the test under a physician's order. These specimens will be collected by trained healthcare providers who will wear the recommended protective equipment. That includes gowns, gloves, and appropriate masks or respirators. Any patient who arrives for testing will enter an isolated waiting room to ensure that they have no further contact with other patients and people. The waiting room and the collection rooms will be negative pressure, and what that means is that the air does not go out to the rest of the world until it flows through a high-efficiency particulate air filter, not much dissimilar that you might use in your house. This helps remove infectious pathogens. How do we collect a patient specimen? It involves a swab. And what is a swab? It's a thin wire, cotton-tipped device that's inserted into your nose. It's a medical procedure. Once the specimen is collected, it'll be safely and securely transported for testing in our clinical laboratory in Oakland or to another facility. In most cases, the test from our facility will be returned within 24 hours. The result will be back, and the patients will be given guidance by their clinical team. Depending on the demand and on the capacity, we may continue to send specimens to the Pennsylvania Department of Health Laboratory in Eastern Pennsylvania or to health department laboratories with our UPMC partners in New York and Maryland. We also may and will continue to use commercial laboratories as they increase their capabilities. At the end of the day, our goal is to serve you well and to help limit this infection as fast as possible. UPMC worked 24 hours a day and 7 days a week to develop our test and to create this collection site. We expect this to be a model for others who plan to create similar types of opportunities. We know how important this capability is to protecting our patients, tracking this pandemic, and ensuring that those who are the most affected can rapidly get the best care and the most appropriate care for them. Now, Dr. Williams will tell you about his efforts to monitor the presence of this virus in our region.
Thanks, Dr. Yealy. Thanks all of you for coming. Having a clinical test to diagnose individual patients with COVID-19 is a terrific achievement, and that's really going to help care for individual patients at UPMC facilities. I'm pleased to share that we have another research testing approach that will help us detect community transmissions. While Dr. Wells' team was working on the clinical test that he just told you about, research scientists at UPMC Children's Hospital of Pittsburgh have been simultaneously developing a research test to screen samples from pools of de-identified specimens from UPMC patients with cold symptoms to see if any of them test positive for the virus. This allows us to kind of take a pulse on when the virus might be present in the region. This research team, which has been working extremely hard, has so far tested over 300 samples from adults and kids at UPMC facilities with cold symptoms. To date, none of them have tested positive for SARS-CoV-2, the virus that causes COVID-19. This does not mean that we should let down our guard, and it does not mean the virus is not here. The world is small, people travel all the time. I think what this data tell us is it strongly suggests that the virus is not widely circulating yet in our region. But COVID-19 remains a critical public health threat. I want to stress again, this test cannot be used to tell individually which specific person is positive for the virus. In light of the pandemic, working with excellent public health partners locally and at the state and regulatory authorities, we decided to test these samples using a research-only version of the CDC assay. This kind of testing is not approved for individual patients in clinical care, but it's powerful enough for this kind of mass screening. We believe that this type of community surveillance is valuable to the Pittsburgh region. Even though it can't diagnose an individual with COVID-19, it can alert public health authorities early when the virus is beginning to spread in the community, so that certain interventions that we've already started, canceling of school and events for large groups, these could be ramped up or extended for longer periods. These social distancing interventions are more effective if they're started before a virus is spreading widely in a community. The goal here is prevention before it's widely circulating, not mitigation after it's already established a foothold in our city. I also thank Dr. Paul Dupre of the Pitt Center for Vaccine Research for sharing the genetic material from the virus to allow us to develop the research test. I'll take questions momentarily.
Thank you, doctors. And thank you to the media outlets that serve our communities for your responsible reporting on COVID-19 and UPMC's preparedness. We will now take questions.